Hey everybody, this is Dr. Caridi from the Austin Gynecomastia Center. My nurses are going to do a beatdown review of what recovery is all about from gynecomastia. Please follow this carefully because it's going to determine your destiny.
Hey guys, I'm Lacey Stewart, nurse here at the AGC, and I'm here to discuss with you the first 24 hours post-op. So you've had your surgery, it's about time to go home. You're in the recovery room. You have your compression garment on, your ACE wraps, all the dressings are in place, and you don't have to do anything with them until tomorrow. So that's not anything we're gonna worry about this first 24 hours. Everybody wants to know about pain. Most people describe the pain as feeling like you've done a real heavy chest workout, 100 push-ups, and it's mostly soreness. So a lot of people don't even take the narcotic prescription that we give them. They'll just take Tylenol. Totally up to you. Everybody's different, okay? And that night, it's really important that when you go home, you rest. This is critical. You don't want to develop what's called a hematoma, and that's just blood collecting in the treated area, okay? And everybody wants to know, how are you going to know if you have a hematoma? So we always talk about the pain scale. You got a 1 that's no pain at all hardly, and a 10 that's extreme pain. So let's say you have a hematoma on your right side. This side is going to feel like you have pain out of 10 out of a 10 on the pain scale, and this is like a 3 out of a 10. You take a look at it, you open up your compression garment. This side is twice the size of the other side. It's bruising, things like that. You let us know. We're going to take care of you. Odds are in your favor that that's not going to happen. But ways to prevent a hematoma from happening in that first 24 hours is to keep your elbows to your side. I've said this in the previous video, and a lot of people felt like they couldn't do basic self-care. You can. Please brush your teeth, go to the bathroom on your own, and feed yourself. That's all fine. The elbows to the side thing is just kind of an over-exaggeration, but I do want you to follow it because it'll keep you out of trouble. And I always tell my patients, do that for the first 3 days. Keep your elbows to your side. Don't do too much with your arms, because when you do, you're flexing your chest muscles, which increases blood flow to the treated area, and we don't want to do that. We want everything to seal off and just stay the way it is when we send you out of here, okay? So just be good, don't do too much, all right? Okay, so you go home from surgery, you're gonna be really good, keep those elbows to the side, have your caretaker look out for you, help you do things, make you a sandwich, whatever. You take your pain meds, you just relax, or your Tylenol. And just get some rest that first 24 hours. And the next day, you're gonna send us a couple of photos so we can see how you're doing. And then we'll talk to you more here in just a few minutes about where you go from there after that first 24 hours. But the first 24 hours out is pretty simple, okay? Just chill, relax, let your body rest, okay? I am gonna move on to talking to you about your supply bag that you're gonna get from solaceprovisions.com. Okay, guys. So I have a supply bag here. This is gonna come in a lot of different colors. This one just happens to be gray. It just depends on the day and which bag you get, okay? But for gynecomastia, they all come with the same supplies in them, okay? So, 24 hours after your surgery, you are going to have your first shower. I always tell people be extra careful when you take the garment off for the first time, because you can get really dizzy, very lightheaded. This is normal. Okay, so what I want you to do is lay down flat on the bed, take the garment off, make sure you feel okay, sit to the side of the bed for a good 10 minutes before you just jump up and get in the shower. Also, don't take a really hot shower for that first time, because, you know, that can make you even more dizzy if you're prone to that. So I've got Dial soap here. This is just kind of a bonus item we've put into the bag for you because everybody wants to know if you should use a special soap. It's just antibacterial. It's fine. If you lose it, no big deal. Soap and water over your incisions is perfectly fine. We want you to do that. We just ask that you don't scrub the incisions, of course. When you get out of the shower, you're gonna gently blot the area dry. Get it really good and dry, and then you'll apply a thin layer of antibiotic ointment. We have these small packs of antibiotic ointment, okay? There's only 4 of these packs in this bag, and we do that on purpose because we don't want you to put too much on and the incision become too moist to heal up nicely, okay? So once you run out of your 4 packs, which will last you about 2 days, 2 dressing changes, get rid of them, okay? On top of the Neosporin will be these ABD pads. Okay, these are there to soak up drainage. You will have 4 incision sites. One up here in the armpit, one at the base of the areola, same thing on this side, okay? The one up in the armpit is gonna drain the most. You're gonna get the most drainage out of that because there's no stitch there. You don't need a suture there, so he doesn't put one there. It'll close up in a few days when it's done draining. So you'll put fresh ABD pads on your 4 incisions, okay? I have enough ABD pads in this bag to last you about 3 days, okay? Once you've stopped draining, you can get rid of those too, okay? And on top of that, you will have some lipofoam. It's this spongy foam. I'll make sure I can put it up in this video because I don't have it on hand right now. But it's this, I say it's like a memory foam mattress, the lipofoam. And it's gonna be a small square that we cut. We put it over the ABD pad, over the treated area, and that helps to make sure your skin retracts back nicely. So we will utilize that a lot, okay? So we'll discuss more of that in person, but you will have lipofoam that you'll continue to use for about 2 weeks after your surgery, all right? You'll even use that after you stop using the ABDs, okay? Just making sure you're following. All right, then you have your compression garment. These are different case by case. Okay, so this one I have an extra large to just show you guys, and this one is a sleeved garment. Some of you will have the compression vest. We decide that based on what size you are. Okay, so if you're an extra large, you're getting the sleeved. If you're a large, you'll also get a sleeved, but if you're a smaller or medium, sleeveless, okay? So this is going to be worn, well, we'll get there because we're going to talk about the 2 weeks thing. So I'll leave that to the 2 weeks. But you'll definitely have this on in the first 24 hours and you'll take it off to shower. Okay? Next thing is compression socks. Okay, these are important to prevent blood clots from forming. This is a really short surgery, so your risk is low, but we still have you wear these. It's protocol, you have to wear them. And we suggest with the gynecomastia surgery that you wear them for about 3 days post-op and then you can be done with them. You will take these off to shower, of course, okay? Also, those are good to just keep around because you can wear them on flights and things like that, so. Okay, next thing in here is my stool softener. Okay, this changes on a daily basis. Just whatever we get in is what we put into your bag. But it's always a stool softener. Anytime you're taking narcotics, you need to take a stool softener. If you're just taking Tylenol, you don't need this, but it's included in your bag, okay? Last but not least, and we'll just briefly touch on this because we're gonna talk about rolling and massage later in this video, but I do have a roller ball. Okay, this is just a handheld massage ball that you'll use starting at 3 weeks. And this is really important to have on hand, so you get that included in your bag as well. We do put a few snacks in the bag, just serves as a reminder to eat with your pain medication because you will get very nauseated if you decide to take your pain meds without eating. And I always say don't eat just soup or Jello. You know, you need some carbs, something in your stomach. So crackers or toast is fine as well. But that concludes everything about your supply bag. We've tried to make it really easy for you out-of-towners coming in. This will be here ready to go. You do have to order it on the website at solidprovisions.com. But it's all going to be here ready to go for you day of surgery.
Hi everyone, I'm Maria. You also may know me as Mar, and I'm going to kind of walk you through the next 2 weeks. So you have just gone through your first 24 hours, and you are going to be wearing your ACE wraps for the first 2 days. So for the first 10 days, you want to make sure you avoid any alcohol, and you also want to make sure you drink 3 of these water bottles per day in 1 week. So for 1 week, you only drink 3 of these per day. Okay? And then you increase just gradually. You don't continue to drink, you don't drink too much right away because that can lead to a seroma.
Let's talk about how you know when you have a seroma. Okay, so it's unlike swelling, it's unlike induration. It's actually feels like a waterbed underneath the skin. It's kind of wild. So you'll touch one side and it'll ripple over. Okay, if this happens, it's nothing to be concerned about. We'll walk you through it. But what you can do to prevent that from happening is you can listen to us when we say limit the fluids and no alcohol.
All right. I know y'all are very eager to work out, which I understand, but we do want to make sure you don't do anything extraneous for the first 2 weeks. Then after the first 2 weeks, then you can start to work out a little bit. Just no upper body, okay? You can do abs, you can do legs, you can do cardio, but no upper body. And we'll talk about when you can start to do the upper body later on in this video.
I want to talk to you guys about rolling and massage post-op gynecomastia treatment. For the longest time, we told everybody to start massaging and rolling at 3 weeks post-op. We told everybody. Recently, we have changed that instruction to say 2 weeks post-op. We really feel that if you get started at 2 weeks, that you'll be able to get ahead of the scar tissue before it kind of solidifies in there. And I am going to go over just briefly with you a few little kind of tips and tricks that I've picked up over the years from patients that I think are really going to be helpful to you. So the first one is make sure your hands are clean. This is super important. And this would seem like kind of common sense, but it's important to note, okay? Make sure your hands are clean, make sure your skin is clean, and make sure whatever device you are using is clean, okay? You can take like an alcohol prep pad and just clean over this area, anything to clean these devices, okay? The idea is that if this is dirty and you're rubbing the area where an incision is, then you're forcing bacteria into that incision. And obviously that's no good. So number one tip is make sure everything's clean. My second tip, don't massage the incision line until all the scabs have gotten off. If you want to speed up that process, you can take a little Q-tip with peroxide and just kind of clean over that incision line, and that will help the scabs to kind of slough off so that you can focus on the area behind the incision line. And that is really, really important as well. I really feel like some people don't go over the areola because that incision is there, and that's a place where scar tissue loves to hang out. Okay, so don't neglect the areola. Okay, when it's time, when there's no scabs on it, then you can really start massaging there and really focus there. Okay, my third tip is I have a suggestion to massage your chest while you're in the shower. And I say this because when you're in the shower, the tissues become softer, it's easier to manage, and it just feels like you're making more progress, okay? And so while you're in there, do the finger massage all across the area, and it really does help. My fourth tip of the day here is picking your device, okay? Everybody's kind of different in what they say works best for them. So we've got the massage ball that is included in your post-op bag, and I really do like this. I feel like it is, it works for what I need it to, right? If you feel an area of hardness, you can really focus and roll over that area, okay? So this is great. It's also easy to keep this in the car if you want to massage while you're driving, okay? Other options though, of course, we've talked about the Theragun in the past. Truly, I don't think that you need to spend $500 on a Theragun. We've ordered a lot of massage guns here for demonstration for patients, and I really haven't seen any that don't work, okay? And that means the $60 one, the $200 one, they all seem to do pretty well. I'm not gonna tell you a brand. Just pick one. If it works, great. If not, send it back, okay? But you've got the bigger massage guns like this one that are they're heavy, all right? This thing is going to do some serious work. But it's heavy. It's user-friendly, but not as user-friendly as this little guy, okay? Of course, it's not going to be as deep of pressure, okay, as this one. But this is a great little massage gun. And surprisingly enough, I got this for $15 on Amazon. And it works fantastic. The idea behind this one is that you can use it kind of anywhere. You could keep it at your desk. You could do it with one hand. So it's definitely user-friendly. It also comes with these little let me show you guys. Attachments, okay? Everybody asks me that too. Which attachment should I use? Use the one that works best for you. I seem to find that most people use this one. So use the one you like, okay? My fifth tip is if it is painful for you to use the massage guns or the rollers and all that stuff, you can always keep your compression vest on with the lipofoam underneath it and massage over that. I'll tell you, it definitely works best when you use a massage gun. Okay, something about that lipofoam being underneath there helps to disperse the power of the massage gun, and it doesn't feel as like pinpoint pressure on one area. And so that's really, really helpful. Also, of course, just use the lowest setting until you kind of work your way up to maybe a deeper massage that you can tolerate easier. My sixth tip is that I want you to focus on areas of hardness, okay? So if you feel a knot in there, I really want you to just hammer that area until it is smooth and flat, and it will be. Dr. Creedy and I talked a lot about that this morning because he knows I'm doing this video, and we talked about how the goal is obviously for everything to be smooth and flat, but I feel like people get discouraged because you'll do the massage and then everything is smooth, and then the next day you wake up and you feel those little areas of hardness. This is the process. And you have to just keep at it. Don't stop the massage because you think, well, there's no point. It's going to be hardened up tomorrow. Keep doing it. Those areas will get smaller and smaller until you've achieved your goal, which is a smooth, flat chest. Okay, my seventh and final tip for this video about massaging is if you are struggling to find the time to do the massage, find a good place. You can do it in your commute. If you're driving to work, if you're driving to pick up the kids, driving to the grocery store, maybe have the massage ball or a Theragun in the car or a massage gun in the car, and just do it as you drive. You can also use your fingers. You'll be surprised to how much time you can rack up in the car in a day. Also, if you are a work from home person and you get to sit at a desk, use that time to massage. You can read emails with this going like this, okay? So just get creative and figure out how to make it work because I promise you, you will be glad you did. Dr. Creedy always says, hey, I've done my best work here. You're gonna leave here and your chest will be smooth and flat, but it's up to you to control the recovery process. And if you just forget about all this stuff, you will not be happy with how it turns out. Scar tissue is difficult to handle once it's solidified in there. So, happy massaging.
So 6 weeks of massaging, and if you're still feeling some of that scar tissue, you can follow up with us and let us know, keep us informed. If you do want to continue massaging that area though, that's very important. Don't stop massaging just because you're starting to feel scar tissue build up. It can only help. You do want to reach out to us, let us know if this is happening, and then we can possibly talk about some steroid injections in the future. So that's a case-by-case basis, and we'll talk more about that later. After your 4-week mark is when you can go full on in the gym upper body workouts. We know that's important for a lot of our patients. So that's when you're cleared to do upper body workouts. And then lastly, scar strips. Scar strips you don't want to use until at least 4 weeks. You want to make sure that incision under your areola is nice and healed before you start using any scar strips. So that can take anywhere from 4 to 8 weeks. If you start using them too soon, it can actually cause opposite effect and start breaking down that tissue and do the opposite of what you want it to do.
I want you guys to know what scar tissue feels like, okay? Because we get a lot of phone calls because you're unsure if it's actually scar tissue. So you don't actually get scar tissue for at least 3 months after surgery, usually. All the rolling that we have you do initially at that 3-week mark is to prevent the scar tissue from forming. Okay, it doesn't mean that it would have to be at the 3 mark that you get scar tissue. It could definitely happen before. But the ways you know you have scar tissue, it is going to feel hard. Okay, like I used to describe it in the videos like a pea underneath the skin. You could feel it like it was a hard knot, almost like a rock under there. This is going to be different than what induration is. Induration is hard swelling that happens initially after surgery. So first few days, you'll notice everything's flat. It looks good. And then as the weeks progress, you'll notice that you have this induration. And the way I like to describe it to patients is it's almost like there's so much fluid from the swelling in the tissues that the tissues stiffen up and harden up, okay? And that's just a reaction to having your surgery. Your body's trying to heal. When that happens, you can usually push down into the induration and you can actually see where it kind of caves in right there. So it's almost like pliable, moldable, that is induration. Scar tissue, you can't do that. If you get scar tissue, it's hard as a rock. Both things still have to be rolled out and massaged out, but that is the difference. And scar tissue, like I said, will form if you don't start the massage like we tell you to.
Hi, I'm Christy, a nurse at AGC. The newer nurse, so I get the short gig. I'm going to talk to you about Mondors. It's a benign condition that can sometimes happen after gynecomastia surgery. It's more common in the more expansive cases where Dr. Caridi treats more than one zone. Dr. Caridi's recommended treatment for Mondors and to prevent Mondors is to start taking Motrin. It's just a small 200 milligram gel capsule 2 days after your surgery. You'll continue to take that for anywhere for 7 to 14 days, and you'll take it every 4 to 6 hours. We recommend that you set a timer so that you know exactly when to take it, because at this point you may not be having pain anymore. If Dr. Caridi believes that you're a candidate for Mondors, he will have us implement the protocol and we'll go over it with you in recovery. Although Mondors can be uncomfortable, it will go away with time on its own. Well, with the protocol.
I just want to take a moment to tell you a few quick things that have changed since our last recovery video that we made. We got rid of the orange scrubs. That's a plus. And we also stopped telling you guys that you have to sleep elevated the night of your surgery. The rule used to be that you had to sleep with your head above the level of your heart. Okay, so swelling would go south. Now Dr. Caridi says, there's no issue with that. Sleep however you want, okay? Just whatever's comfortable for you. You're probably not gonna be wanting to sleep on your side or your stomach, though, these first few days out of surgery. The other thing is ice. Because we have incorporated the lipofoam that will be on your chest, if you put an ice pack over this, you're not gonna feel it. So we found that you benefit more from the lipofoam than you would from the ice pack. So just stick to the lipofoam, forget the ice pack. A few common things that we get phone calls about that I just want to give you guys a heads up about is numbness in the treated area. It is very common for you to have numbness throughout the area that was operated on. It's a nerve thing. It's going to happen. Also because of that, the nerves will reconnect with time and it will almost feel like a little shot of electricity across your chest, like a lightning bolt went across your chest. That is normal. It usually happens for about 2 seconds and then goes away. As the months progress, this is going to go away. It's not going to be a constant thing throughout your life. Another thing is dark nipples. Now, this is a little freaky if you don't know that it could possibly happen. Your nipple may actually scab over and look like it's black or dark purple. This is also common and is caused by the Vaser that we use. It's that real hot probe that Dr. Caridi uses to soften up the gland as much as he can so that it's easier to get out. And that's causing trauma behind the nipple and it just scabs over. The scab does go away and it looks fine afterwards, but it can be a little shocking. So I wanted to give you guys the heads up on that. It's also common for you to get axillary swelling. So that's just swelling up here in the treated area, okay? It's not all about the front of your chest. You know, a lot of times Dr. Caridi goes under the armpits, up here. So don't be alarmed if you do see swelling here. If you have been put into a compression vest, meaning it doesn't have any sleeves, okay, and you do notice that you're getting that axillary swelling, you can always incorporate a compression shirt. It's just, you can go to Academy, you can go to Dick's Sporting Goods, Amazon has them. Put one of those on that has some sleeves, and that'll really help to put a little extra pressure here as you're healing and help get rid of that axillary swelling you may be noticing. All right, guys, I want to show you an example of lipofoam. This, as I always describe, feels like a memory foam mattress, and this is really great for forcing out swelling that can occur after surgery. It's great for preventing a seroma from happening, and it's really great for setting the skin, okay? And really what I'm saying is I'm trying to help you prevent a crease in your skin. Creases happen either from having excess weight loss before surgery or just age. You've lost that elasticity in your skin, that bounce back that some people have. So if that happens and you're that person, you want to use this lipofoam to almost plaster the skin against your chest. Okay? Now don't set it and forget it. And I've come up with this to help you remember. This is going to be against your skin. I want you to go in throughout the day and put your hand inside your garment and pull up on the skin and make sure it's flattened out, okay? Don't set it and forget it, okay? This could be used, you could use half of this, you could have bigger pieces, you may have 4 pieces. It's just a case-by-case basis. And if you need more of it, you can always order it on Amazon. Just look up lipofoam. Lots of companies make it, but it's really great to utilize so that you don't get permanent creases across your chest as you're healing. Is that it?
That's it.
We covered it all?
We covered it all, I'm pretty sure.
Okay. Well, if you've made it this far, you're obviously a patient or taking care of one of our patients. So we just want you to know how much we appreciate you and how we could not do this without you guys traveling here to let us take care of you. If you have any questions, please let us know. We're here for you, and we hope you have a great experience with us.